and welcome back to Your Autism Game Plan. I'm Joya Vanderlaan, a family nurse practitioner, a functional medicine specialist, and an autism mom. Today we're going to talk a little bit about speech delay in children with autism. It's estimated that about 40% of children with autism have speech delay or are nonverbal. That's a lot. Now, there are different reasons for this, and there are different things that we can do to help these children. And so I want to go over a few of those things today. One thing that I want to mention for sure when we're talking about speech delay or children who are nonverbal is that it's easy to think that just because they aren't saying anything, that they don't have anything to say. But really, many times these children fully process and fully understand well what other people are saying. It's just that they can't get their thoughts and their ideas out, which can be very frustrating for them and for us as parents. But I want us to remember that just because they are not able to tell us their thoughts and feelings does not mean they have no thoughts or feelings. In one of my previous videos, I had mentioned how autism and Asperger's and a couple of other diagnoses in about 2013 were all lumped together into one autism diagnosis. The main difference between autism and Asperger's is speech delay in autism, whereas kids with Asperger's often don't have the speech delay. Now that those diagnoses are all lumped under autism, that means that some kids with autism have speech delay and some kids with autism do not have speech delay. That becomes confusing. Sometimes when we're going through the diagnostic process, we want to check off boxes of, well, the child has speech delay, therefore they have autism. However, we need to keep in mind that autism and speech delay, while they are very commonly coexisting, just because a child has speech delay does not mean they automatically have autism. There are a lot of other reasons why a child could be delayed in their speech. The other qualification, since we have lumped all these diagnoses together, is that it's possible for a child to have autism even though they don't have a speech delay. That may be what we used to call Asperger's. Under the category of speech delay, there are several different subcategories. One of those is apraxia. Apraxia is a deficit in the person's motor ability to create words. Now, this is less a muscle problem and more of a neurological problem where the brain is not properly communicating with the muscles in a way that will make the mouth, the throat, the tongue be able to form and speak words properly. Now, if the root cause of a child's speech delay or speech impairment is apraxia, and if we know that is a neurological condition, my first call after ruling out, kind of the standard neurological concerns with maybe a neurologist or your child's pediatrician, my first recommendation for therapy would be to consult with a chiropractic neurologist. In my opinion, they are going to be the best at deciphering where exactly in the brain is the problem happening and what can be done to address those problems and hopefully fix those problems. Other types of speech delay or speech impairment include receptive and expressive speech delays. I want to explain those two terms just a little bit. An expressive speech delay is when a child has trouble expressing themselves or getting communication out, communicating in your direction. Receptive speech delay or language delay is when the child has problems receiving communication or language, and so they may have trouble understanding or processing. They may be slower to understand or process. It does not mean that there is an intellectual problem, but more of a processing problem within the brain, and so that would be a receptive or receiving problem in terms of speech delay. When we talk about interventions or therapies for various speech delays, once again, it's important to look at what is the root cause. Is it a medical issue? Is it a neurological issue? What's going on that's causing the speech delay? Typically, therapies will include both therapeutic and medical treatments. And so the therapy interventions are things like assistive communication devices and speech therapy, all those kind of therapies. Those are really valuable. What I'm going to focus on more today is on the medical treatments and what can be done medically for a child. That's more where my specialty lies, and so that's what I'm going to mostly focus on today. It's important to understand that I'm not promoting only a medical approach or only a therapy approach. I think that the two really have to be used together so that we can get our children optimal results. I do want to talk about some medical conditions that could cause a speech delay though. And here's a list of those things. Some medical issues that need to be looked into would include things like seizures, mitochondrial dysfunction, cerebral folate deficiency, various nutrient and other vitamin deficiencies that may be causing a speech delay or speech troubles. Sometimes something as simple as a tongue tie, where the frenulum under the tongue is too tight and restricting tongue movement. And then, of course, here we are again looking at retained primitive reflexes. Certainly, retained primitive reflexes can be one of the root causes of a child's speech delay. We definitely want to have those looked into. There are quite a few supplements that have been proven to help with speech delay in patients. I want to be clear, not all of these supplements are necessary for all patients with speech delay. When you have a child with speech delay, it's important to figure out what are the root causes of your particular child's speech delay, and then target those problems with the particular therapies, maybe some medications, and maybe some supplements as well. With that in mind, I'll give you a quick list of the things that have been found to be helpful. Vitamin B12 is a big one. Make sure to watch my video on B12 if you haven't done so already. Folate or folinic acid is another nutrient that's super important for speech, especially because it relates to neurotransmitters and methylation and detoxification. L-carnosine and L-carnitine are really important amino acids, especially when it comes to speech, but lots of other things as well. CoQ10 or ubiquinol, another important one. Again, a lot of that has to do with functioning of the mitochondria or those energy producers within our cells. And then omega-3 fatty acids, B6, particularly the activated form, which you'll see labeled as P5P, and magnesium. So B6 and magnesium together have a lot of studies that have shown that those are effective together for helping children with speech delays. And then if your child is deficient in vitamin D, as many of us are, getting those levels to an optimal level may help with speech delay and many other things as well. The last one I want to mention is iron. Iron plays an important role in things like muscle development, cognitive development, and so if it's low, it can cause various problems, including speech problems. Be aware though that too much iron can be toxic, so this is one of those supplements where you'd really want to have a provider order blood work and determine if your child truly needs iron or not. A few last words on speech delay. I know it's exhausting to deal with speech delay and with autism in general. Never give up on your child. Always have hope. Always be curious in trying to help your child. The other thing is that it's important to assume competence. Just because our children can't tell us what they're thinking and feeling, again, that doesn't mean that they're not having thoughts or feelings that they really want us to know. So always assume competence. And then lastly, as I always tell you guys, remember, be gentle with yourself. You're doing a great job.